My name is Emil. Emil Guintu. I'm a physical therapist by background. Yeah, like Jody said, I am one of the managers, owners of Rehab Max. Like we provide outpatient services at clinics and also at home. So, but yeah, I've been doing this since, wow, it's been a long time. Like since 1997, I graduated, so I've been doing this quite some time already, which is hard to believe for myself too. So yeah, so that's just a little bit of background about myself. I've been doing this for, is it 28 years now? Wow, I can't believe that. But 28 years and gone through every setting, and outpatient and home health is what we're currently providing now through Rehab Max. So okay, so we'll get right into it. Fall prevention. So what actually is a fall? I mean, we all know what a fall is, right? But an actual definition of it is really an event which results in a person coming to rest inadvertently onto the floor or whatever surface that is, right? So a little bit of statistics when it comes to falls. Incidents, 1 in 4 Americans age 65 and older are at risk. And as of last year, 800,000 patients a year are hospitalized from falls. And you know, as the years go on, we know that there's going to be more incidents because there's more people just getting older as well, though. So there certainly is a high incidence of falls that are happening. I mean, as myself being a physical therapist, I work with so many patients that have had falls, and we try to prevent that, and also we try to help people get over after a fall, after they through an injury or the adverse outcomes that happens after a fall has occurred. So. Injury risk. What do you guys think is the most common injury after a fall? Broken hip. Yeah. So that's probably the number one injury that happens or adverse outcome after a fall. 20% of falls result in serious injuries such as hip fractures or TBI or a traumatic brain injury. So when we fall and they don't protect their head, or somehow they hurt their head, that's what we call a traumatic brain injury. And it causes a lot of damages and risk for the mobility getting worse from what they were prior to, right? So more than 95% of hip fractures occur after falling. So that's why it is the number one injury that happens after a fall. It's just, like I said, 95% of it is from a fall. So just going back to injuries again, falls related adverse outcomes. So we talked about the hip fractures, the traumatic brain injuries. When we talk about falls, we want to talk about the critical fall. And if you guys can read there, the critical fall is when a fall happens to a person and they can't get up and there's nobody there to help them, right? So when a critical fall happens, we're going to see that they might be there alone for hours. And in some of my experience with patients I've worked with, they might be alone there for days, which is unfortunate. So what we want to say here is that we see that for every hour that an older adult is on the floor, there's chances of adverse medical conditions happening. So we talk about pressure ulcers, we talk about dehydration, or even hypothermia. Again, from my own experience, I had a patient actually have like even nerve damage. So she was, she fell, she was laying on a hard wooden surface for a couple days. It might have been the way she was, yeah, luckily her family came by to finally check up on her, and they were able to call the paramedics. But maybe the way that she was, on the floor with the pressure on one leg on top of the other, where she ended up having a foot drop. So that's what we call the critical falls, when the person is falling and they don't have anybody there to help them. But as Carol mentioned, there are some devices that can help call for help, but we'll talk about that a little bit more later. But those are some of the conditions that happen when, they've been laying there. I mean, I've had several patients that have been, laying there for 24 hours or even more than that. Like I said, 2 days after a fall like that. So other adverse effects or outcomes would be a development of fear of falling. So when I see a patient that had a fall, right away, it's like they have that fear of falling because they've fallen and they don't know how they could have prevented that, right? So that's where that fear comes in. And when you have that fear, the tendency is you kind of withdraw socially, or you also have a lack of activity in your day now. So, you know, the fear of falling makes you want to just either sit around and not do anything, so you don't have that risk of falling when you're walking or doing any standing activities. But the social withdrawal, I mean, it's good that you guys are, you know, coming out to the community and all that. But, you know, when we have like places like assisted living facilities, we'd have patients that don't even want to come out of their rooms because they have that fear of falling, and they would just rather stay in their rooms and just not even risk falling anymore because, you know, they've had that incident already. So that activity curtailment means like the lack of activity now. So when you have somebody that's fearful, they're socially withdrawn, so they're not going to activities, they're not getting out in the community and doing stuff like they normally do, and they just stay at home and not do a whole lot of things at home, right? So they might be just sitting around, laying around, watching TV, and in turn, what is that? It almost becomes like a vicious cycle, right? So now you're at home not doing stuff. What ends up happening is you get weaker, your mobility gets a little bit harder, and then you have troubles with you know, your balance or whatever it might be that causes your mobility to be a little bit harder and difficult, right? So, and then the last one would be the increased risk of for skilled nursing facility placement. So hopefully that, you know, if you had a fall, you go to the hospital, that person gets into a nursing home for the short-term therapy that they may need and get back home. But sometimes people, because, you know, they can't get over any injuries that they've had from a fall, may have to be placed somewhere on a long-term basis, right? So, but as you know, as a therapist, we always encourage independence and try to keep people in their homes as much as they can be, and live life independently, right? So, okay, then when we talk about falls, we also can talk about indoor and outdoor falls, and each one of those have their own characteristics as well. So we have, you know, for the indoor falls, we have the risk factors, usually older in age. And for some reason, it's more of a female gender, and it's usually an indicator of poorer health. So we might have somebody that's more living a sedentary lifestyle, that's in home, doesn't really go out much. So, you know, the tendency is that they get a little bit weaker, mobility gets a little bit harder, and they leave themselves for a risk for falling, right? So, on the other hand, when we talk about outdoor falls, we have, you know, of course, risk factors, which we'll talk about later again, but a little younger in age, and they sense more of the male gender, and they're more physically active. So these are people that are getting out in the community, maybe doing exercise out in the parks or whatever, and they just happen to have a fall incident that, you know, that might have occurred. So, okay. All right, so we get into the risk factors. When we talk about risk factors for falls, we talk about intrinsic and extrinsic. The extrinsic risk factors are morely the environmental causes of falls. So when we talk about like being in your home and all that, we talk about the throw rugs, we talk about slippery floors, or even if you have pets, and certainly like clutter around the home would be things that can cause falls within the home. The intrinsic risk factors are more of the person-specific medical conditions, or maybe even age-related changes in your body that may affect your vision. Who said the vision? About someone was saying vision. Oh, is that you? Yeah, vision. Then the vestibular system, or the balance center in our ears. And what's not there is also like the your feet, your positional sense of your feet. That plays a really big part of our balance as well. So, you know, the risk increases with increased number of risk factors. Also, previous falls. If you had previous falls, are more likely, and hopefully that won't be the case, but more likely to have another fall unless we do something to change that, right? So, people with balance and gait impairments. Again, like you were talking about your vestibular system there, Ed, and also gait impairments. If there's a trouble with people with trouble walking, if they're using assistive devices, or if they're not using the proper shoes to get around with. I've seen a lot of good shoes here though right now. I'm really I see what you guys are all wearing, but that's pretty good. I mean, the one thing that we shy away from is like shoes with heels. So the ladies here, they have to get walking shoes are pretty good there. So that's what we recommend. So, and then medications. What do we think about with medications? What happens? What causes like a risk for falling? Side effects, such as the dizziness, right? Yeah, you can be tired and exhausted as well. So So they have different medications can cause, have several side effects as well. So the dizziness, yeah, like the side effects of like feeling tired, or orthostatic hypotension. Everybody know that term? You know what that is? When you stand up too quickly and then you feel lightheaded, right?
Well, your blood pressure drops.
Drops, right? Exactly, yeah. So, oh, our nurse here, yeah, she knows that. But yeah, exactly. So orthostatic hypotension is something that we want to make sure, like we teach our patients to, when they're standing up, if they have medications that could cause that they want to be able to just stand up slowly and take a minute and stand there before they start moving, because we want to make sure you're not feeling lightheaded. And if they do feel lightheaded, to take deep breaths, or maybe sit back down for a little bit then after that, right? So, but always just kind of seeing how your body feels after you've gone from like laying down to sitting up, or from sitting to standing, okay? All right, interventions. So interventions, we have so many things that we can do to help prevent falls, right? So when we're talking about the orthostatic hypotension, it was really education to patients, like I just mentioned, and how to, just take a step or take a breath before you move, and making sure that you're not feeling dizzy. Optimize vision. So again, like I said, when it comes to balance, vision plays a big part of our balance, right? So what do we want to do at home? Like what modifications would you think would help us when it comes to vision?
Well, you have to make sure you have good lighting everywhere.
Good lighting everywhere, right? So good lighting everywhere, especially with stairs, if you are doing stairs, right? I think you want to make sure that the lighting is good on there so you can see each step that you're trying to negotiate there, right? So but also in terms of like at nighttime when you're trying to get up, I should say a lot of falls happen at night, right? When people have to go to the bathroom, they try to get up, they can't fully, I mean, if it's dark, they can't see where they're getting to, and they might trip over something. So we want to make sure that the lighting is good wherever you're, especially at nighttime when you're trying to get to the bathroom or whatnot. So, and we talk about addressing foot problems. So having a good walking shoe, right? And like I said, I looked at all of you guys' shoes there. They're pretty good there. So we want a good walking shoe, good grip, and getting rid of the heel. So, and we want to assess if the proper assistive devices are being used properly, or even if a person needs one, right? So I know I come across a lot of patients that don't want to use one because it makes them look old, right? Right. So, but then we also want to assess and make sure that they do have an assistive device as they need it, right? So, and hopefully, if it comes to the point where you are needing it, that you're open to using it. So we'd rather have you be safe with your mobility versus having a fall incident, right? So, but yeah, I mean, it's good to make sure if you have a cane or you have a walker, that you're using it properly too, right? Yeah. So some people don't realize when you have a cane, you want to use it on the hand that's opposite the leg that might be a little bit more weaker, or if you have an issue with that leg, right? So, and that gets a little bit more difficult if you are right-handed and you happen to have a leg that's also, maybe it's like, say, we just fractured a hip on that right side. So it might be awkward, but then we try to teach them how to do it the right way and use the assistive devices the right way too, right? So when it comes to a rolling walker, right? A rolling walker, when we've had a lot of patients that use walkers, what's the tendency of a walker? They want to hold on to it, but they kind of hover over it, right? Or they push it right in front of them. So when you have somebody that you're seeing that's using a walker, you want to make sure that they're standing upright, keeping their shoulders back, and just taking steps within the walker so it's not too far in front of them where they're having to bend forward. And that can be a risk for falling too, right? If they're not using the walker properly though too. And with a patient using the walker improperly and bending forward like that also causes pain to your lower back. So people that are using walkers that aren't using it the right way, you might end up having to have them deal with low back pain as well because of the way their posture is. Okay. And then again, optimize home safety. So looking at all the stuff that in terms of lighting, that everything within your home is lighted up good, that there's no clutter. What would you guys say is a good assistive device for like in the bathroom, that if someone needs assistance or needs extra help, there can be applied to the bathroom there? Grab bars, yeah. So that's one thing that we look at, to make sure that they can get into the shower or the bathtub safely. and efficiently. And grab bars are usually the ones that we use and advise if they need something to help them with that. So again, the home assessment we were just talking about. So environmental hazards and clutter, suggesting the modifications like the grab bars. Not just the grab bars, or even within if you're having trouble getting in and out of the bed, knowing that you can have like a rail on the side there so you can pull up, or maybe you just hold on to it as you're getting into the bed, right? So the plan B, any type of device that can help alert somebody when you have had that fall and you can't get up, right? And then another one would be maintaining exercises, right? So who here has a daily routine of exercise that you guys do? Yeah, okay, yeah, so that, even as, when I see my patients too, that's the one thing that we teach them is to have a home exercise program. And as we get older, we just want to stay active. And like I said, like Carol's a good example, being at 90 years old and she's still walking around, getting out in the community, that tells me that she's always remained active throughout her life, and I see a lot of those patients. More recently, I've had like 95, 99-year-old patients, and they're still pretty good living at home because of the fact that they've remained active. So maintaining exercise is very important as we get older, right? So places, that you might, like with assisted livings or independent living facilities, they might have exercise classes that you can join, right, on a daily basis. But we also encourage you to just do your own exercise. And if nothing else, walking throughout the day is going to help you, right? So indicated here was just strengthening specific muscle groups like the quads. Quads are just like your thigh muscles here, or your hip abductors on the side here, your hip muscles, because the hip abductors are what we know them to do this motion of kicking out the leg, but also when you step on that whole leg, that's what kind of balances our hips when we're walking, and to walk normally and straight as we go, So maintaining that strength in those the muscle groups in your hips is very important as we try to maintain independent, mobility. And if nothing else, physical therapy, right? So when we talk about, I'm a physical therapist. What I want to say about physical therapy is don't wait until it's too late, right? It's not about seeing patients after they've fallen, but also, preventing the falls. Because, there's so many patients that I've come across that they've already fallen, but then even months leading up to that fall, they knew they were already, declining in their mobility, they're getting weaker, their balance. And a few of you have mentioned too yourselves, right? You already feel like your balance isn't as good, and you're feeling like you're not as steady as what you used to be. So talking to your doctors about getting therapy before you even have a fall is very important too, right? So we can get that strength back up, we can work on your balance, and we can make sure that you're safe and independent with your mobility, okay? But then, benefits of physical therapy would be improving strength, balance, coordination, reducing the risk and any fall-related injuries, enhance mobility and independence, promotes overall physical fitness. Yeah, normally when you go in for physical therapy, we'll do initial evaluation and figure out what the problems are, right? So if it's related to any weaknesses or impaired balance, those are the stuff that we'll try to target and make sure we can improve on that. So but whatever your prior level of function was prior to any injuries or any falls that you've had, that is always the goal, to get you back to doing, what you were doing prior to that, right? So, and if you were doing, if you're well and independent prior to that, most likely, you get back to that level of function again, right? As long as you work hard with the therapy and get your strength and balance better. But we'll do when we do the initial evaluation, we also do standardized tests that show us if you are at risk for falling or not. And a more common one is what we call a Tenetti POMA test. We have a patient go from sitting to standing and then walking, and at every step of the way we're grading them on whatever they do and how balanced they are, if they're having difficulty, or even the way they take steps. If they're small steps or if they're proper steps, we're checking off every little thing that they do to see how much of and it's a 1 to 28 grading system. So if they're not getting up to a 19, then we know they're at risk for fall. So it's been a proven test to let us know that, if they're scoring 19 or below, that they're more of a high risk for falling then. So just to talk about some of the other stuff that we would work on is a lot of strength. Sometimes it's just a matter of strengthening too, right? If you're a little bit weaker in your hips or your legs, then we can work on strengthening exercise. But when it comes to balance and fall prevention, a lot of stuff is related to balance exercise as well. So, okay. But yeah, I mean, that's certainly something to look into. And when it comes to, your mobility not being as well as it used to be, and you're noticing that. And that's what I was telling you, that, we don't want to wait until it's too late, right? So to get the therapy, because we're not there to just see you for therapy after an incident like that has happened, or like a fall or an injury has happened, but we want to prevent stuff too, though, okay? So proprioception exercises is just it's just exercise to help with your balance as well. So when you talk about proprioception, it's talk about the movement sense. So again, it goes back to the three main systems of our body when it comes to balance: is the vision, the feeling in your feet, and your inner ear vestibular system there. So when it comes to balance and the problem with your feet, but what do you guys what comes to mind when you have issues with your feet that might make you lose your balance?
Numbers.
Oh my gosh, yeah. Girl, you get the star for that. Yeah, do we have anything there? Any prizes, Jody?
Yeah.
But anyways, yeah, numbness plays a big part with balance. When you don't have the proper feeling in your feet, that's gonna cause you to be really imbalanced as well, though, right? And then when it comes to your vision, if you're not able to see where you're going to, but even if you did like a balance exercise, like we have our patients do, with typically another test would be to have their feet close together and close their eyes for 10 seconds. And then if you see them swaying side to side or like that, then we know there's an issue with either their feet feeling or also the inner ear. Because if you take away the vision, then the other two are not able to compensate for their imbalance there, right? So. And then what we also do in therapy is gait analysis. So the proper way of walking, right? So if you're not wearing proper, shoes, or the way you're walking, or the way you're using a assistive device like we talked about, that's always going to affect your balance as well and cause you to be at risk for falls. So, the proper use of a walker, not bending forward, or even using a cane wrong. Carol doesn't properly. But yeah, we see how everybody walks and make sure that they're corrected as they need to be, so they can walk independently, or modified independently, as we say, when they have to use an assistive device. So, okay.